Good morning, good afternoon, and good evening. Hey guys, welcome back to the channel. My name is Omer, and I'm a doctor. My passion is to share valuable knowledge that can enhance and potentially save lives. My mission is to empower you with information that can make a real difference in the world. In this video we will be exploring urinary tract infections, commonly known as UTIs, their causes, symptoms, and available treatment options. I will also be exploring natural methods to prevent and manage this all-too-common condition. Whether you've personally experienced a UTI or simply want to be well-informed, you've come to the right place. Understanding urinary tract infections, UTIs. So, what exactly is a UTI? A urinary tract infection refers to an infection that affects any part of the urinary system, which includes the kidneys, bladder, ureters, and urethra. The most common cause of UTIs is the introduction of bacteria, such as Escherichia coli, into the urinary tract. These bacteria can enter through the urethra and multiply, leading to infection and subsequent symptoms. Exploring the urinary tract. The urinary tract is a remarkable network of organs and structures responsible for the production, storage, and elimination of urine from our bodies. At the core of the urinary system are the kidneys, two bean-shaped organs located in the back of the abdomen. The kidneys play a vital role in filtering waste products, excess fluids, and toxins from the blood to produce urine. They also help maintain a balance of electrolytes and regulate blood pressure. From the kidneys, urine flows through thin, muscular tubes called ureters. These ureters transport the urine from each kidney to the bladder, a hollow, balloon-shaped organ situated in the lower abdomen. The bladder acts as a reservoir, storing urine until it's ready to be expelled from the body. When it's time to urinate, the bladder contracts and urine travels through another tube called the urethra, which connects the bladder to the external opening. In males, the urethra serves a dual purpose by carrying both urine and semen. In females, the urethra is shorter in length and solely responsible for urine elimination. Understanding the anatomy of the urinary tract is crucial for understanding how UTIs can develop. Bacteria that enter the urethra can ascend, or travel up, through the urinary system, potentially infecting any part along the way. The most common type of UTI, called a lower urinary tract infection, typically affects the bladder, known as cystitis. In more severe cases, the infection can spread to the upper urinary tract, involving the kidneys. This is known as pyelonephritis and may result in more serious complications. I will do a separate video specifically about pyelonephritis, so make sure you've subscribed and your notifications are turned on. Recognizing symptoms. UTIs are much more common in females because of their anatomy and short urethra. Recognizing the symptoms of a urinary tract infection, UTI, is crucial for early detection and prompt treatment. One of the most common symptoms of a UTI is an increased frequency of urination. You may find yourself needing to visit the bathroom more often than usual, even if the amount of urine passed is small. This frequent urge to urinate is often accompanied by a sense of urgency, as if you cannot hold it in. Pain or discomfort during urination, known as dysuria, is another telltale sign of a UTI. This sensation can range from a mild burning or stinging feeling to intense pain. It occurs due to the inflammation of the urinary tract caused by the infection. You may also experience a fever or high temperature and generally feel under the weather. Observing changes in the appearance of your urine can also provide clues about a potential UTI. If your urine appears cloudy or has a strong, unpleasant odor, it could be an indication of an infection. In some cases, you may notice the presence of blood in your urine, giving it a pink or reddish tinge. This condition, known as hematuria, should be taken seriously and warrants immediate medical attention. Pelvic discomfort or pressure is another symptom that may accompany a UTI. You might experience a general discomfort or a sense of heaviness in the pelvic or lower abdominal region. This discomfort can be mild or severe and may persist even after urinating. If you notice any of these symptoms or have a suspicion of a UTI, it is crucial to seek medical attention for proper diagnosis and treatment. Early intervention can help prevent complications and alleviate discomfort. Diagnosis. Diagnosing a urinary tract infection, UTI, involves a combination of clinical evaluation and laboratory tests. The first step in diagnosing a UTI typically involves a thorough medical history and physical examination. Your healthcare provider will ask about your symptoms, their duration, and any factors that may increase your risk of UTIs. They will also perform a physical examination, which may include checking for tenderness or pain in the abdomen or pelvic area. You will be asked to provide a urine sample which will be dipped to see if you have any bacteria or blood suggesting a UTI. If this is positive, your doctor will likely give you antibiotics and send off your urine sample to the hospital microbiology labs for further analysis. This will confirm the infection and the type of bacteria potentially causing the UTI. The lab may also advise us on the specific type of antibiotic that is best to treat the bacteria growing in the urine. Potential complications. While urinary tract infections, UTIs, are common and often resolve with appropriate treatment, it's important to understand that complications can arise if UTIs are left untreated or become recurrent. Ignoring or neglecting UTIs can allow the infection to spread and potentially lead to more serious health issues. One of the potential complications of untreated UTIs is the progression of the infection to the kidneys, resulting in a condition called pyelonephritis. When bacteria from the lower urinary tract ascend to the kidneys, they can cause inflammation and infection in the renal tissue. Pyelonephritis can be accompanied by severe symptoms, such as high fever, chills, back pain, nausea, and vomiting. Prompt medical attention is crucial to prevent further damage to the kidneys and potential complications such as kidney scarring or abscess formation. Treatment options. When it comes to treating urinary tract infections, UTIs, the primary approach typically involves the use of antibiotics. These medications are effective in targeting and eliminating the bacteria causing the infection. The specific antibiotic prescribed will depend on factors such as the severity of the UTI, the type of bacteria involved, and any known allergies or sensitivities. A typical course of antibiotics for a simple UTI lasts for 3 days. However, if the infection is more serious or complicated, and specific bacteria are identified by the labs, then the course is likely to be for 7 days. Also, men are treated with 7-day course of antibiotics due to their different anatomy. Commonly prescribed antibiotics for UTIs include trimethoprim/sulfamethoxazole, TMP/SMX. This combination antibiotic is commonly used as a first-line treatment for uncomplicated UTIs. Nitrofurantoin. This antibiotic is often prescribed for both acute and recurrent UTIs, and it is particularly effective against bacteria commonly associated with UTIs. Ciprofloxacin. This broad-spectrum antibiotic is reserved for more severe or complicated UTIs, as it covers a wide range of bacteria. Natural prevention and treatment. While antibiotics are the primary treatment for UTIs, there are also natural strategies that can help prevent UTIs and support the healing process. Incorporating these practices into your routine can complement medical treatment and promote urinary health. Stay hydrated. Drinking an adequate amount of water helps flush bacteria out of the urinary tract and dilutes the urine, reducing the risk of infection. Practice good hygiene. Maintaining good hygiene habits, such as wiping from front to back after using the toilet and keeping the genital area clean, can help prevent the spread of bacteria to the urinary tract. Cranberry juice. Drinking cranberry juice or taking cranberry supplements may help prevent UTIs by preventing bacteria from adhering to the urinary tract walls. However, it is important to note that cranberry products should not be used as a substitute for medical treatment. Probiotics, such as lactobacillus, may help maintain a healthy balance of bacteria in the urinary tract, potentially reducing the risk of UTIs. Consult with your healthcare provider before starting any probiotic regimen. Cystitis sachets such as potassium citrate and sodium citrate may also be helpful to treat mild symptoms. You can buy these from your local drugstore. Also, make sure to wash the skin around the vagina with water before and after sex. Additionally, urinate directly after sex to reduce the chances of developing a UTI. For babies and young children or those who are bedbound, ensure nappies and pads are changed regularly and as soon as possible. Avoid irritating substances. Certain substances, such as harsh soaps, douches, and feminine hygiene sprays, can irritate the urinary tract and potentially increase the risk of UTIs. Opt for gentle, unscented products instead. Avoid wearing tight underwear, especially that made from nylon. Additional considerations. There are a few specific considerations regarding urinary tract infections, UTIs, that are important to address. These include UTIs in children, recurrent UTIs, catheter-associated UTIs, and the impact of UTIs on older adults. UTIs in children. While UTIs are more commonly associated with adults, they can also occur in children, particularly in infants and young girls. In children, UTIs may present with symptoms such as fever, irritability, foul-smelling urine, or unexplained changes in behavior. Prompt diagnosis and treatment are crucial to prevent complications and ensure the child's well-being. If you suspect a UTI in your child, it is essential to seek medical attention for proper evaluation and management. Recurrent UTIs. Some individuals may experience recurrent UTIs, which can be frustrating and impact their quality of life. If you have recurrent UTIs, your doctor may recommend additional investigations to identify any underlying causes, for example ultrasound scan of your kidneys, ureter, and bladder, as well as blood tests. Management strategies for recurrent UTIs may involve a referral to a specialist for further evaluation and management, such long-term antibiotic prophylaxis. Catheter-associated UTIs, also known as complicated UTIs, if you have a long-term catheter in place or are having to self-catheterize or use a convene, or then you are at an increased risk of developing a UTI. The catheter is a foreign body which may be carrying bacteria and directly introduces to your urinary tract. Impact on older adults. UTIs can have a significant impact on older adults, particularly those residing in long-term care facilities, such as care homes or nursing homes, or individuals with underlying health conditions. Older adults may present with atypical symptoms, such as confusion, agitation, off legs, or generalized weakness, rather than typical urinary symptoms. UTIs in this population can lead to serious complications, including delirium, falls, and hospitalization. Regular monitoring, early detection, and appropriate management of UTIs are crucial in older adults to prevent adverse outcomes. And that's it, guys. I tried to make urinary tract infections super simple for you. My wish is that this information will be a helpful resource for either you or someone you love. As a full-time doctor, my goal with this channel is to share my medical knowledge with all of you to help improve your overall health and well-being. If you found this video useful, please consider subscribing for more helpful content just like this. I'll be publishing a new video every week, so if you have any suggestions for future topics, please leave a comment below. Until then, take care of yourselves and stay healthy.